Hello, ladies. Good to be here again. How are you doing? So, today we are talking about a topic that is so precious to me. If you know me a bit or a lot, you know I'm so passionate about pregnancy. And I'm sure I'll be talking a lot about pregnancy on this channel. But please don't get bored of me. Don't chase me away. This is just me. So, today we'll be talking about how to humble pregnancy like a pro. Drum roll. So, are you pregnant? Congratulations. Are you looking to get pregnant? Very soon you'll do so. There's a video on getting pregnant, how to get pregnant. I'm going to link up to this video. So do well to go watch that one as well. And then, if you know someone that is pregnant, you could send this video to them to encourage them and to help them so that they can make the most of their pregnancy. Yes. So my name is Emma, in case you've not come across me before. And here you're welcome to Care and Counsel with Emma. Here we talk about everything that touches ladies from late teenage years, early 20s, to as old as you can think of. We talk about everything that pertains to women, especially emotionally. Yeah. So most of the things we talk about are things that concern women psychologically, things you've gone through as a woman and how it affects you in the now, and things you'll be going through at this stage of your life and in the future also. So everything we talk about here will be beneficial to you in one way or the other. So if it is not, you could go through the ones that we've done before and you will see something that will benefit you. I promise you that. And if you have anything you want me to talk about that is bothering you, you can put it in the comment section. And when next I'm planning to make a video, I'll consider doing that for you, just for you, because I love you and I care about you. So let's go into it. I'm a mother. I've had 4 successful pregnancies. I can't say how many I had that are unsuccessful because I've not kept track of that. But I've also accompanied a lot of women in their pregnancy journeys. So this has been on for over 20 years now. So trust me when I tell you these tips, you're going to benefit from them. So I'm just going to classify them. I'm not going to say, okay, it's going to be 10 or 20 or whatever, but trust me, these tips are very important. So I'm going to start with eating tips. So you know how when you're pregnant, especially in the early parts of pregnancy, it's very difficult to get food down for most ladies. The first trimester, you're having nausea or you're not, but you're finding it difficult to eat. Your body's trying to adapt to the new work it has started, the work of producing a full-blown human being. That's a lot of work. So this time you see yourself either feeling tired, sleeping a lot, or being nauseous all day, or some part of the day. That's the part that is called morning sickness. So if you're going through any of this, some of the tips that will help you eat better include cooking in batches ahead of time and freezing them. For somebody that you're staying where you don't have a lot of friends that you can eat from, or you don't have family that you can eat from, because pregnancy, especially throughout the pregnancy, not only in the first trimester, you feel like eating what someone else cooked for most ladies. So if you don't have anybody you could go to for such, you could ask your hubby or your partner to help you cook when you're not around so that you don't perceive the food. Secondly, you could cook in batches and keep in the freezer so that in like a week's time when you warm that food, it's gonna be like someone else actually cooked it because you're not the one making it from scratch. you see. So something else you could do is adding a lot of chili, even if you did not tolerate chili before now. Trust me, I could cook and forget that I didn't put chili in the food. But during pregnancy, I learned to start eating chili because someone told me about it, and I learned that it helps you keep the food down. It makes you not to feel so nauseous. So if you're okay with that, you can just increase your chili intake a bit. If you're already taking much chili, please don't take too much. I don't think it's advisable to do so. So you increase a bit of the chili. Another thing that helps is crayfish. If you're African, you should West Africa mostly know what crayfish is. That is dried prawns or dry shrimps, that kind of thing. So it helps to, when you're making stews, tomato stews and sauces, when you put a little of that shrimp in it, the dry one, it helps to reduce the sourness of those things. So when you use it to cook, it gives you that satisfaction that you've been looking for. You might be wondering, oh, I want to eat something, but I don't know what it is. This is what you want. So if you have an African around you, West African, you could ask them to teach you how to use this or to teach you what it is, and you can benefit from that also because it's going to help in calcium provision in your body. Yeah. So the next thing we are going to move to is sleep, sleep, sleep. So one thing you need to know is that your body is doing a lot of work. Producing a full human being or maybe multiple births is not an easy task. So as you go along, remember when people are saying eat for two, it's not, it's just a mindset. So whatever you eat, your baby takes, and then the remaining is kept for you. So no matter what you eat, your baby will still get more than enough to eat. So what you do is so that you don't start piling up weight that you'll be wondering how you're going to lose when you're done. Just set your mind to know that you should just eat more nutritious and not more quantity, you see. So if you set your mind that way, it turns out that you start behaving that way. But if you think about, oh, I'm eating for two, then that is what you would actually be doing. So have that in mind. Secondly, your sleep pattern. Try, because you most likely be feeling tired, especially in the first trimester and towards the end of the pregnancy. So any little time you have to rest, to raise up your feet, to have a nap, take advantage of these times and actually do so. Just relax, close your eyes, and calm yourself down. Calm yourself down of all the things that are worrying you, that are bothering you, all the fears that you have. You might have the fears of how you're going to take care of a whole newborn baby. You might have the fears of, many things that could be bothering your mind. You might have those fears. So just use this time to relax yourself and, calm yourself. If you're a music lover, put on music, calming music, and listen to the music, and then try and sleep if you can. But when you're doing this, don't sleep towards the evening because it's going to affect your night sleep. One thing else about pregnancy is that during pregnancy, you have weird dreams. Oh, pregnancy, you're gonna have dreams that are out of this world, that you're gonna be wondering how these dreams came about. This is the time that you're gonna discard many of the dreams that you're gonna be having because most of them are just pregnancy induced dreams. So pray about them, cancel out their implications, and move on. Don't allow it become a burden for you, something that you hold on to and be thinking, oh, how can I do this? How can I do that? Was it me climbing a tree? Was it my baby being held upside down? All those kind of things. Don't allow the dreams bring worry to you. So if it's something you think that, oh, this might happen, pray. In fact, just pray against every of them, because it's gonna help give you peace as well. Yeah. So something else you need to be doing in pregnancy, especially towards the end. walking, taking walks, doing soft exercises. Some people have ability to do more. If you have ability to do more, just keep moving, just keep exercising. No, your body might be saying no. Listen to your body, but don't just sit doing nothing. You could dance, you could walk around. It's going to help the baby position. It's also going to help you so that you have what do they call it, strength to do the pushing when it comes, if you're going to be doing vaginal birth, and if you're going to be doing surgery. Just keep yourself moving. It's going to help a lot. Yes. So something else you should be doing in pregnancy is preparing your body for delivery. So for breastfeeding, preparing your body for breastfeeding, you get Vaseline, Vaseline, petroleum jelly. You get it and you use it to massage your nipples from like 7 months of pregnancy, or even a bit earlier, like maybe 5 months. You should start doing that. It helps to condition your nipples so that when you give birth, it's easier to breastfeed. Also, another place you should be massaging using Vaseline or any other massaging thing you can get that is okay for your vaginal opening is to massage your vaginal area, so that if you're doing vaginal birth, you wouldn't have too much. Your body would have been used to stretching already. So you pull a bit, pull a bit, pull a bit while doing the massage. Pull the vagina, pull it a bit, pull it a bit, pull it a bit, so that it gets used to being expanded that way, and it becomes more elastic, so that when you're giving birth, you don't have issues with tearing. Yeah. So something else I'll talk to you about is dressing up while pregnant. So I know a lot of us, considering how the world is now, there's a lot of economic tension. So if you're able to buy new clothes for pregnancy, oh, beautiful, you go ahead and buy your clothes. You could buy pre-loved clothes if you're not able to afford the new ones. The good thing about buying pre-loved is that you would be able to get stuff that are quality, and sometimes they are even new, just that those people don't need them anymore. So you could search online, you could go physically to shops where those things are sold and look for lovely outfits. Don't say, oh, because I'm pregnant, let me just look anyhow. No, you gotta look good, girl. So go look for things that are lovely, things that are comfortable. And one thing about dressing up during pregnancy is you should buy things that you can combine. For example, I'm wearing this top and I want to go out strolling. I could just wear it to go out strolling. And for example, I want to go to church, I want to go to a formal location, I could throw a jacket on this. So things like jackets, when I talk about jackets, I mean like blazers, suits. Those things come in very handy, because when you wear a small top that is loose around the belly, a lot of those tops are not maternity tops anymore, because a lot of us do wear those kind of tops. So when you wear them, you could wear your blazer and look smart, wear your flat shoes. It's not so advisable to walk on heels at this time. Once in a while is okay, but don't make it a habit, because it's going to be affecting your waist area, putting pressure on that place because of the pregnancy, and it might start causing backache and waist pain in future. So once in a while, maybe for occasions, it's okay, but don't make it a habit that you're standing on heels all day or that sort of thing. You could dress classy without wearing high heels, you see. So just look pretty. And then if you're into using chemicals to, make your skin lighter and all those kind of things, this is the time you should avoid such. Avoid them, because these things, they go into your bloodstream and they could go into where the baby is and affect the baby as well. Alcohol is a no. Alcohol is a no-no. Have you ever heard of fetal alcohol syndrome? It's a condition that is not good at all. So just like you have issues that create special needs children, this is one of those issues. You could Google it and read about it. So you wouldn't want any of your children to develop any issues, and then it will be traced back to something you did. So if you're an alcohol lover, please let it go for the sake of the baby in you or the babies in you. Yeah. So these are the tips and many, many more. So if you have anything to say or you have any questions to ask them in the comment section and we'll come back to it. So another tip that we have is lying down in pregnancy. Some of us, I'm one of those people that loves lying on face down on the tummy. So for the first trimester, that's okay. You can still lie on your tummy. But from the second trimester, that's from 4 months and above, you should try and be lying on your side. Towards the end, the third trimester, don't even bother lying on your back at all, because it's going to be affecting blood vessels that carry blood to the baby and carry food to the baby. So it's not advisable. And doctors would advise that you lie down on your left side mostly, but it's okay to lie on the right side as well, but concentrate on the left. And if this is becoming a burden for you, you could get pillows. It mustn't necessarily be the pregnancy pillow. That is for, aesthetics. You could also use the pillows you have in your house. Maybe you could gather the pillows in your sitting room or your living room and just use them to improvise. Put in between your legs so that you can reduce the pressure on the other leg and reduce the pressure of lying down on your side. So, which of these things do you already know? And which is a new thing for you to know? Yeah. So if you have more, you've gone through pregnancy and there are hacks that worked for you while pregnant, please put them in the comment section. And if there are any more hacks that you want to know about, or there's one you've heard about and you're not sure whether this is for real, could you ask that in the comment section as well? Yeah. So these are the things that we are going to be doing when we are pregnant to help us enjoy our pregnancy and also end the pregnancy well. So see you in the next one. Remain blessed. If you've not subscribed, what are you waiting for? Have you subscribed to the channel? Do you find value in the things that you've been seeing on the channel? If you do, please do subscribe. And if you think there are people that benefit from the things on the channel, please send this to them so that they can also benefit. And see you in the next one.